everybody. Meet the Fab Four of our medical spa. I'm Katie.
I'm Ann.
I'm Angie.
I'm Sarah, and we do all the injectables and laser treatments here at the spa.
And we just wanted to welcome you tonight to our virtual laser event.
We encourage you to stay till the end for our question and answer session.
Attendees who stick around to the end will be entered to win a TNS serum, and this is valued at $300.
And the winner will be notified via call or text.
So why do I need or want a laser treatment? When we're doing treatments such as Botox or fillers, those address wrinkles to certain areas of the face or volume concerns that we may have in the skin, but they don't really do anything for our pores or some of the deeper etched in lines, texture concerns, brown spots, reds in the skin. So we have multiple lasers here at our medical spa to make sure that we address the different concerns that we might have or the different issues. And all of our lasers have their own unique abilities. So we have multiple lasers in our toolbox, so to speak. And so my analogy for that would be if you were a painter doesn't have just one paintbrush in their toolbox, so to speak, or one color to create their masterpiece. And so it's the same thing with us with lasers. We might need multiple lasers in order to address different concerns. So it's not characteristic for somebody to come in and maybe they are concerned about their brown spots, but then also about wrinkles on their face. Well, we might have to stack lasers or use multiple lasers for one treatment in order to address all of those concerns. So we have multiple lasers, again, as I said, that address different concerns. And so our lasers range from what we would consider no downtime, or they're called non-ablative, meaning that they do not break the skin barrier. And then we also have all the way up to full laser resurfacing lasers, and those are what we call ablative lasers. So those do have some downtime. Our lasers, we like to call them tunable, meaning that we can customize your treatments depending on the wrinkles or the different concerns that you might have. So we can customize it with your schedule as well as the concerns that we're trying to address. And so your length of downtime, so to speak, might be relative to what we are trying to achieve with that. So I always suggest keeping in mind that regardless of the laser that we choose, for optimal results, we are typically going to want to do more than one treatment to achieve your results. So how do I know which laser is going to be best for me and my concerns? Your best way of achieving those results are going to be to come in for a consultation with one of our skincare nurses, and we will customize a plan that is appropriate for you and your skin concerns.
A common concern that we see a lot of is patients wanting options for treating sun damage, brown spots, hyperpigmentation. We recommend Cyton's BBL laser. It is the most current technology in broadband light to address these concerns. We will sometimes add in the halo laser if we're wanting to take it a step further to address that deeper pigment or more resistant browns. And this is what we call laser stack. We would have you come in for a consultation and develop a treatment plan specific to your needs. At that time, we would also discuss how many treatments are needed, which when it comes to the BBL is usually 3 or more treatments, approximately a month apart. There's minimal to no downtime. If we do add in the halo laser, that can add a few days of downtime to your schedule. So we would go over all that and answer any other questions you have.
So one of the top concerns that we talk about on a daily basis is aging. And aging skin is skin that is more dull, it has textural issues, more visible fine lines and wrinkles, pores are enlarged. And what do we typically recommend for that? Halo. Halo laser is an ablative laser that corrects many of those things that I just mentioned. And it is a hybrid laser, so there's two lasers firing at one time or simultaneously. The first laser I like to think of as mows the lawn, just very lightly mows the lawn of the skin. The second laser at the same time is aerating the lawn and creating microchannels, which through the microchannels, it applies heat, which stimulates elastin and collagen and all of the things, all of the good humors that we need to improve that skin health overall and restore the brightness and youthful qualities that we all want. So if I'm going to recommend a halo, first I want you to come in for a consultation. We need to look at your skin and give you specific recommendations that are catered to your specific needs. And let's face it, some of us are genetically gifted and may need less than others. However, we can make a treatment plan for everyone and all skin types, really and truly. Halo can be used from the palest of pale to the darkest of dark, and it is safe for that because it's a tunable laser. We'll come up with a plan for you. Downtime can be also tailored to your specific needs, but typically it's 3 to 5 days. There will be some swelling, some more than others, but I'll walk you through all of that. And then some roughness to the skin, which is actually MINS or microscopic epidermal necrotic debris. I know that's a mouthful. There will not be a quiz later on that, but that will fall off in about 5 to 7 days. And then you'll have nice, beautiful, clear skin, and people will get what's called a halo glow about 10 to 14 days post-treatment, and it looks fantastic. And if you can do one a year, your skin will be better for it for life.
I'm going to talk about rosacea. Rosacea is a common chronic inflammatory condition of the skin. It is defined by diffuse redness. You can see little fine broken capillaries in the skin, and in some severe cases, you can have red pustules along with that. Some common triggers of rosacea include caffeine, spicy foods, alcohol. So you'll just get a little bit more flushing when consuming those things. So treatments we offer here include BBL and Clear V, and the combination of those two together works really, really well. So we often pair BBL and Clear V together. They both work at targeting redness in the skin. BBL gives a more diffuse, broad treatment, where Clear V can specifically target individual broken capillaries. So together, this combination does a really great job of cleaning up a lot of that redness in the skin. Both of them don't have a significant downtime, so your reds in your broken capillaries might look a little bit more angry, but you're welcome to put makeup on afterwards, and you get very minimal swelling with these treatments. Generally, people will do a series of anywhere from 2 to 5 treatments to get optimal results. And then with rosacea, it typically requires maintenance. So every year you're going to be looking at, kind of repeating these treatments because it is a chronic inflammatory condition that you will always be managing. So if you'd like to come in and talk with us more, we would love to meet with you and further discuss what would be best for your skin and your specific skin conditions.
Thank you for joining us for this portion of our virtual laser event.
Be sure to stick around for the live Q&A for the next 15 to 20 minutes.
You can put your questions in the question box and we will answer them live.
And don't forget, stay till the end so you are eligible to win our advanced TNS serum.
Yay. Thank you.
Thank you.
Hello, hi
Hi, guys.
everyone. Thanks for joining in. So we're going to answer a few questions that you guys might have about lasers. Feel free to enter anything into the question box, and we will do our best to answer those questions for you.
And again, we're going to tell you, stay to the end so you can
have a chance to win our products. And learn about lasers, right? So the first question we have is, can you cure rosacea? And I talked about this a little bit in my portion of the video, but it is a chronic inflammatory condition. So there is no cure for it. And a lot of skincare conditions we treat actually are something that you'll always be managing, so doing something annually for your skin to keep it healthy, whether, that be BBL and Clear V if you have rosacea to kind of calm that inflammation in the skin, or doing something like BBLs to clean up maybe sun damage that you got over the summer once a year is a great protocol. And we have things for just about everything. So yeah. And Katie, do you want to answer what causes brown spots?
Okay. So brown spots is kind of that's a big question to bite off, but really there's a couple of different types. Most commonly, brown spots are caused from sun damage and sun exposure, and those can develop throughout our life. And you can have a brown spot pop up that was really caused by a sunburn that you had when you were a kid.
A lot of the damage we see, the brown spots we see pop up as we get older, but it's really from what we did when we were younger.
And then the second type of brown spot is a melasma type of brown spot, which is different. It's something that we really have to see it and take a photo of it, to actually a Visio photo, which is a specialized picture, which will give us a deeper look into the layers of the skin so that we can determine if it is melasma. But it's often a patchy like brown spot or area of brown that can be caused from hormone imbalances. And it is typically aggravated by not only the sun, but heat. You can be just hot and actually have it get aggravated and flare.
Absolutely.
Know all too well about that.
Yeah, me too. Sarah and I both
Yes.
suffer from melasma. And fortunately we work here and we have the advantage of having treatments available. But anyway, that's something that if that is something that is a specific problem for you, we would absolutely talk about that in the consult. But there's definitely different types of brown and different ways that you would want to treat or address those brown spots, because melasma is a little bit of a different animal because it is aggravated by heat. So I won't go into too much detail about that, but we are well versed in the treatment of those different disorders.
And I like your point on that, because it's not all brown spots are the same. Some are deeper in the skin, some are more superficial. Melasma is a tricky pigmentation. Any provider that's treated it can tell you that. So it's really good for us to individually, give you a treatment plan based on what you have going on in your skin, because everybody's skin needs are different. And that's why we have to carry a lot of different lasers, because they all kind of do a little something different, or products, complement that very well as well. And sometimes we'll pre-treat with products.
Absolutely. A couple of you have asked about price range. That's a little difficult. I think it can start anywhere from $500 and go up to probably $3,000, depending on the laser and how deep we're going.
How many treatments?
We would love to answer that specific question for the people who have that, but we almost need to see it to see which laser is the right one for you and the right treatment for you. Again, when we do light base like the BBLs, they usually start around $500 per treatment, which can help with the brown spots, rosacea. But if we're targeting wrinkles and deeper things, we probably need the halo, or even something deeper called laser resurfacing, which can be upwards of up to $3,000. So, but we'd love to answer, give you a price quote. We just need you to come in for the consultation.
Yeah, which I think you kind of answered with the what do you do when you have brown spots along with rosacea or red spots. So, BBL, it's a broad wavelength of light. And so that laser is great for both brown and red, most brown spots, if it's related to sun damage, because it will target both melanin and hemoglobin, thank you, in the skin. It's been a long day. And so it's going to treat both red and brown. So that's a great option. We do sometimes stack lasers, you know, if you're trying to do browns, reds, and a little bit of textural concerns, or there's one little vessel right here that's driving you crazy. Well, we can get out our ClearV that will trace that vessel and basically kind of heat it up so that that vessel wall shuts down and your body can cart it away. So we do oftentimes like to stack lasers. The more you stack, the more you combine, the more treatments you do, the better your skin will get over time. So, you know, it's always a work in progress when it comes to your skin and kind of taking care of it.
And most patients, just from the years of doing this, they struggle a little bit with browns and reds, even if it's not rosacea. You know, some people, you know, their sun damage can come in the form of reds. They can get broken capillaries from other things other than rosacea. And we stack lasers all the time.
So then another question is, what laser treatment would be best for pigmentation and sunspots? And does it help with skin texture? I think a great laser treatment for that this fall would be combining a BBL with a halo. The BBL is going to really get a lot of that superficial sun damage and redness, and then we can go a little bit deeper with the halo to create a controlled injury, and that will cause your body to kind of create an inflammatory response to wake up and heal that injury and create collagen in the process, which will improve pores, texture, fine lines, and also your browns and reds. So yeah, that would be a great treatment for you. What would be the best treatment for red spots left over from acne?
I can take that one. That's really BBL. If it's the redness that surrounds old scarring, that I think that's what we're referring to. That I would say BBL or broadband light. BBL is good for taking care of reds and browns and can help with texture and somewhat with tightening, all of those things. And oftentimes in acne scarring, if there is no true textural changes and the area is flat where the acne scar was, then BBL alone can be the solution for that. If there is some textural changes or a little indentation where the acne spot was, then we may stack lasers and use the profractional possibly along with, which wasn't really covered in this video per se, but it is similar to halo in some respects, as in it creates little micro channels in the skin, but that's the only, it's not a hybrid laser, so that's all it's doing at one time. But we can target those acne scars with that laser along with BBL. But oftentimes if we can clear the red first with broadband light, then take a step back and look at the textural changes and see, okay,
you'll see an improvement.
Right.
And also if you shut down that inflammation or that post, inflammation, it's going to decrease your risk of scarring because the longer that is red and inflamed, the higher chance of, those acne marks becoming more of a textural scar. So it is always good to kind of try to shut down that inflammation. Also on the flip side of that, if you still have active acne, it is always good to get that under control because otherwise you're just going to be chasing your tail with some of these laser treatments. So seeing a dermatologist or talking with us about, what we can do to try to reduce the active acne is helpful as well. Are any of the lasers useful for tightening skin?
Yes.
So I mean, I've done a lot, we've all done a lot, and you just see the improvement in the quality of the skin's envelope. And so with the word tightening, I don't like people to think it lifts because it does not lift, but it does build collagen and kind of shrink a little bit of that skin's envelope. So it keeps the skin.
Which this ends up tightening.
Yes, which gives you that tightened effect, but it does not lift. So if you're doing this, that's more surgical. But, building collagen in the skin, it will, improve the quality of your skin and give a little bit of a tightened look to it. But it's.
And I think with the skin tightening, it's something we have to see. And we can let you know, if you're a good candidate for the skin tightening or if you're looking at more surgical options. Right. And sometimes it just, like I said, it takes us seeing you and evaluating your skin. And during all these consultations, just to let you know, your we have 4 board certified plastic surgeons, and we have one come in to make sure they agree with the treatments we're recommending, or if they maybe have something else they would recommend, or make sure you're a good candidate for it.
Next one is, what take-home products do you recommend from a laser treatment? So I'm assuming this is like post-care immediately, and you can kind of talk about how we typically give what we give for that. And
Well,
Katie had a halo on Friday.
I did. So halo to my
can talk about
face
your
and neck.
recovery.
Really, I don't know if that shows or not. Maybe a little bit.
I can see it.
Still red. Still feels very sandpaper-like, especially along the sides of the face. But that's the MINS, or the microscopic epidermal necrotic debris. In case anybody was listening to me on the video, I talked about that. But
In case you want to write that down,
that is still there, but it's much less. Actually, majority of it has actually come off. My neck still feels a little bit rough, but necks heal. As a rule, they heal more slowly than your face because they're not as porous, and they just need a little bit more time, a little more ginger care. And really, the care is super, super easy. I mean, it's just gentle cleanser, and typically we use a CeraVe or a Cetaphil, and then a gentle moisturizer to follow that. And I put the moisturizer on 3 times a day just because I felt a little bit more dry than typical. And
we send you home with that after halos.
And that's very soothing. And then on day 3, I was able to wear sunscreen on top of my moisturizer. And really, that's all I have on right now is a little bit of sunscreen. And okay, so I have on some lipstick and some mascara. Truly, that's all things. I'm being totally clear. But the skin is really starting to get that glowiness, which is common after halo, and it is really quite nice. I had some swelling underneath my eyes and kind of in the most evident in the bridge of my nose for a couple of days after, but I mean, I'm day 5 now, and looks pretty good.
So after the halo, outside of the gentle cleanser, moisturizer, we'll send you home with our Color Science face shield. Obviously, sunscreen's super important after any laser treatment, or actually every day all day long.
Yeah. Right. So if you don't have a sunscreen, this is one product you should definitely invest in and wear it every day to prevent further damage.
Cloudy days, winter,
rainy, snow.
Right.
It's coming soon.
Indoors, maybe.
By a window, driving your car. So next one is, how are ClearV and BBL different?
I think BBL kind of it targets more like that diffuse redness, maybe that comes around with rosacea, where, like you said earlier, the ClearV it's a light base, but it's a little beam that comes out, and we can actually trace the little veins to target them a little bit more efficiently.
So it's ClearV is better for like those specific individual larger vessels. It is one laser wavelength, so it's a 1064, but it has a high affinity to the hemoglobin, so it's very good at shutting down vessels. BBL is going to be a good overall treatment, so really diffuse redness, like you said, and browns. So oftentimes, if any of us are treating rosacea, we'll pull out the ClearV sometimes, because there's a couple large vessels that we see them and we got to get them. So good question. Can you correct any brown spots on my hands? I've got my nails done for years, and I've started noticing brown spots on my hands.
We do actually a lot of hand treatments. Again, back to the BBL, the broadband light. We do treat those treatments all the time. I think as we age, we first notice our face and neck and chest, and then our hands. Yep. And when we drive, they sit up there. So sunscreen, very important on our hands. But yes, we do a series of treatments. No real downtime.
2 to 3, depending upon the extent. But
your hands will be a little red
at the most.
If you have a lot of browns, the browns will get really dark.
Mm-hmm.
Is the halo procedure painful? I'll let you answer this. I just did it to
you. It can be. It can be, is my honest answer. Everyone obviously has a different threshold for pain. And I do think that people's inflammatory response is very individual. I found it to be very comfortable. I really, truly did. The most uncomfortable I think I was throughout the entire experience was the night of when I was trying to go to sleep. My neck was a little bit tender, and then I kept rubbing it up against the pillow, and that was irritating, and it would kind of wake me up. But I mean, that wasn't bad. The numbing was very effective, and I literally could have fallen asleep during the treatment. I almost did, actually. So
most people, I don't
yeah,
think, complain during the treatment, maybe towards the end,
Mhm.
but it does start to burn.
Think bad sunburn,
Some
heat
people-
coming
yeah,
out of your skin.
some people get a really intense heat response, and I've had people really, feel very, very hot. And
And they
by
may
the time
feel
we were
hot for an
done,
hour or two.
And the nice thing with Halo is that it is an adjustable laser. So we can adjust the density, the depth based on what we're treating in your skin. And that can affect, maybe how intense it is, or a
Right.
little bit, less for maybe our melasma patients because they can't tolerate enough heat. So, those things can be tailored too. So it doesn't have to be like, extremely painful. But if you're someone that's like, I got a high pitch tolerance, let's do it, then we can also crank it up a little bit. So
We also have a nice chiller that you blow on
Zipper
your
Mhm.
face during the procedure, which is why she was so comfortable.
Mhm. It's like a walk-in freezer in your
Yeah.
hands. You just
wintertime's the
It's
best
fantastic.
for it because you
Yeah.
go outside and the cold air hits your face and it just feels so good.
Yeah.
But
So
Yeah.
the majority of my patients, they'll say about the time they're leaving that it's burning pretty intensely. It'll burn intensely for maybe an hour and a half, 2 hours, and then it turns off like a light switch.
Yeah.
And just feels kind of tight and tingly.
And someone asked in the questions if we use the Visia in consultations. Yes, we do. We do. It is a nice tool. I think it can be very helpful in some cases. In other cases, I think it's most helpful when you do a follow-up, when you've started someone on products or done laser or something like that, and you can come back and
6 months and
decide.
evaluate and
Yeah.
see their skin
And-
looking better.
look at your progress. But yeah,
skin's kind of like a longer haul thing. I think we
Yeah.
get so used to the instant gratification from our Botox and fillers. And so sometimes you don't see those slow changes that happen. And after you have like a Halo, you will still build collagen for 6 months after. And so those slow little incremental improvements you don't see because it's such a slow thing until you go back and look at, a picture from 6 months prior. And you see those improvements in the quality of your skin.
And I think most lasers are like that.
It's
it
a
takes-
slower,
it's a slower
It's not
process.
as
It's gonna take
instantly
you a little
gratifying
time. Right.
as the injectables, but worth it. And what do we suggest for large pores? I personally like Halo because I think it gets deep enough, it's fractionated, and then maybe like profractional.
Absolutely.
Halo's easier.
I think
than-
all the lasers improve the pores to some degree.
they do to some degree, but I'm just gonna be the naysayer here and say that pores are a daily grind.
Yeah.
Especially for
They are.
people that have oily skin. If you're not doing your skincare every single night and pretty regimented about it, no treatment in the world is going to make them better and make them stay better for a really long period of time. It's just
Yeah.
not going to happen like that.
And you'll still
So-
have them.
Yeah.
They're
Right.
just going to be
But
a little smaller.
we
or-
can certainly improve
you
them.
know,
And then if
tighten.
you continue your products, that's great. Then
And-
they will stay much improved.
And I
But-
even think for the older generation, I think we think, oh, our pores are larger when we're younger, our skin's oily, we break out. But really, as we get older, we hear more complaints of my pores are large, and if you think about how the pores get congested, if we're not doing something like you said on a daily basis, those pores get stretched out. Well, as we get older, our elasticity in our skin isn't as good, so they don't bounce back quite as well. So we do need to be using product every single day.
It's like brushing your teeth. You come to see us for the dentist, and then at home, you brush your teeth with your
That's
products. So
That's right.
yeah, keep your skin good. Do you use lasers on other parts of the body?
Yes.
We do.
Yeah.
Depending, the skin off the face is much different. It's thinner. It heals differently. So we have to proceed with caution. But no, we have a lot of great treatments for different areas of the body,
We have BBL Hero,
which is great. Yep.
Yeah, that's great for like brown spots, redness, especially like a lot of the décolleté, the chest area.
Next.
We use
Yeah.
Clear V on the
Arm.
legs all
Yeah.
the time.
Yeah, for little spider veins.
Halo.
Halo,
Also.
neck, chest. That's a common one. But like Andrew's saying, you do have to lower, your intensity so that we're safe because that skin doesn't heal as well because it is thinner. It doesn't turn over as fast. So we just got to proceed with caution when we're treating the body, and it can take a little longer to get there for results.
More treatments.
Mm-hmm. Yeah. So wear your sunscreen there too.
Right.
We're going to push the sunscreen all day long.
Do you offer IPL?
We did.
Well,
15 years ago.
BBL and IPL are essentially
Similar
very similar animal.
Yeah,
BBL,
I think BBL is the newest generation,
Right.
probably.
It's a little bit more tunable. We can adjust our settings a little bit better with BBL. BBL and IPL, intense pulse light, broadband light. It's similar technology. So our different brands. So we have Cyton's BBL technology, which I've worked with a different IPL actually in the past. And I think BBL is far superior to it. So yeah. But yes, we offer IPL BBL even better. B for better.
Yeah.
Are there any lasers that help with stretch marks and skin tightening for lower abdomen?
So skin tightening for lower abdomen. Yes, we have it's tough to answer that question without seeing it first, because when stretch marks is mentioned in the same question as helping tighten that skin, I get a little bit leery just because stretch marks tells me that that skin is really pretty weak and pretty thin. So I would want to see it before saying yes for sure. There's some other treatments actually available, such as microneedling. It just depends, really, truly. But yes, we do. We have a skin tight laser. We can use BBL Hero. BBL Hero has shown in studies that it does have some very impressive results as far as skin tightening is concerned with doing a series of treatments, like 4, 5, somewhere in there, in that neighborhood. And because you can't be as aggressive with heat settings on the body, typically that's the reason the number of required treatments is a little bit higher. But skin tightening treatments also can be used where we just heat up the deep dermis to stimulate similar to a tissue injury is what I'm trying to say, which stimulates collagen. And that treatment, when done with repetition 4 or 5 times, that can also be something that we might recommend, but really we want to see it first, especially if they're stretch marks.
Yeah. And when we see you guys, we'll always be realistic with expectations and honest on what we think we can achieve with, non-surgical options. And,
Absolutely.
And we even, the surgeons do come in too. And if they think it's something that, for what your goals are, makes more sense.
Is it achievable?
Their end, right. So, we're never going to tell you to do something that we don't think is going to give you kind of what you're going for as far as your goals. When will the patient appreciation specials be announced?
The week before, I believe.
Yeah, I think generally it's
the week before. So
week or 2 before.
Yeah.
And so for those that don't know, we have a patient appreciation event every year. This year it's October 2nd, 3rd, and 4th. Call in or online. And, so if you want to meet with us before and talk about lasers and then have a game plan, the event is the best time to buy those treatments because everything is discounted. So your injectables, your laser treatments, your skincare products, you can buy it all at that event. And then you can come in later throughout the year and have it done.
It's discounts we don't offer any other time of the year. It's a great time to come in for a consultation. That way, like she said, we have a game plan. We can recommend what's best for you and your needs and then give you, a price quote. And then once the specials come out, you'll know how much savings you'll get.
I think we got to all of them. Does anybody else have any questions that we didn't address or answer? Or, of course, we would love if you are interested in wanting to sit down and have an individualized consult with us. There will be a link after this that you can click on to have us reach out to you and set up that consultation and kind of discuss what would be best laser wise for your specific needs. And we would love to meet with you and address those. But if you have any other general questions, we're happy to answer them. Otherwise, thank you so much for joining us tonight. And I hope you guys were able to learn something. And
Yes.
you know,
Thank
we'd
you.
love to see you in person and make a plan for you specifically. So, and then we will notify the winner once we get everyone's names who are still on this thing tomorrow. Or here's the products you'll get. It's actually more than the TNS. So you'll also get an HA5 and what is that guy? Sorry, Katie. And a sunscreen. So sunscreen, yay! So we will be notifying you, I think, tomorrow on that once we get everyone's names in the raffle that stayed till the end. So thank you.
Yes, thank you.
And yeah, drop your stuff in the link if you want to meet with us. So
We look forward to meeting you.
yeah. Bye. Anything else?